Myself, Dr. Sinu I am a physician and diabetologist at SUT Super Specialty Hospital, Trivandrum, Kerala. Today, I will be talking about diabetes and health. So, what is diabetes? Diabetes is when the blood glucose or sugar value is more than normal. Normally, we need glucose in blood. We get glucose from the food and also body produce it. This glucose will enter into the cell with the help of a hormone called insulin, which is produced by an organ called the pancreas. This insulin is required for entering the glucose into the cell. From the cell, this glucose produces energy. In diabetes, there is a lack of insulin or reduced insulin and resistance to insulin. Hence, this glucose won't go into the cell and we won't get energy, and the blood glucose level will be on the higher side. Globally, the incidence of diabetes is increasing. In India itself, the incidence is increasing at a higher rate, mainly due to the changes in the lifestyle, decreased physical activity, and consumption of unhealthy food. We are consuming more of calories, sweet food, and saturated fat. India has world's second largest diabetic population. So mainly diabetes has of two types, type 1 and type 2. Type 2 is the commonest one. It is due to the reduced production of insulin from the pancreas and also due to the resistance. It is mainly seen from the age of 30 years and it has association with the obesity, decreased physical activity and eating unhealthy food. Type 1 is less common. It is mainly due to the autoantibodies. That is, body's own immune system will attack on the pancreas, which produce insulin. Hence, insulin is not produced from the pancreas, and these patients they will require insulin lifelong. So, what are the symptoms of diabetes? Most common symptoms we hear is increased hunger, fatigue, increased urination, feeling of thirst, dryness of mouth, blurring of vision. Why there is an increased hunger in diabetes? As said earlier, the glucose in the blood is not entering into the cell, hence energy is not getting produced. So the brain will signal the body to eat more to get more food to get more energy. Therefore, we get more hunger. Why there is a fatigue and fatigue? Because less energy is produced, hence there is fatigue. Also, there is increased urination because normally the kidney will filter the glucose which is coming from the blood. In diabetes, the amount of glucose in blood is more, hence the kidney will function over time, resulting in more urination. Due to the more urination, the body will signal us to drink more water. Hence, there is increased thirst in diabetes. There is blurring of vision because the fluctuating glucose value in the blood will affect the lens and lens may swell. Hence, there is blurring of vision. Over time, the long-standing diabetes, it may cause damage to the blood vessels of the heart, kidney, brain, and nerves. As a result, these patients are more prone for heart attack, stroke, kidney damage. The damage to the nerves will cause tingling and numbing sensation of the hands. And due to the decreased blood flow to the hands also, even if there is small ulcer, it may fail to heal and may lead to amputation of the foot. So these are the major symptoms and major complications of diabetes. So what are the risk factors? Type 1 is, as I told earlier, is mainly due to the autoantibody. So risk factor is mainly genetic. If your sibling or parents have type 1, then you are at a higher risk of developing type 1. In type 2, risk factor is mainly due to external factors like obesity, food we are eating, lack of physical activity, and there is also genetic factor also involved, which is there, but morely on our physical activities and food. So, any preventive methods we can go. In type 1, unfortunately, there is no preventive because it is an autoimmune disease. Only thing is that if the child has the symptoms of diabetes, we can check his blood sugar, or if his immediate family members has type 1, antibody testing can be done. Type 2, there is prevention. Type 2 prevention include a healthy lifestyle. You should have a healthy weight, moderate physical activity of at least 150 minutes per week, and having a healthy food. Healthy food means you should be taking around 50% to 60% of carbohydrates. These carbohydrates should not be refined carbohydrates. Avoid taking white rice, white bread. You should take brown rice, and carbohydrates you can take green leafy vegetables and fruits which are in low glycemic index. The protein content should be between 15 to 20 percentage. Avoid taking too much of animal proteins like red meat. You can take uh, lean meat or fat free milk or animal proteins like pulses you can take. And among fat, 20% of the diet should contain fat. In that, less than 7% should be of saturated fat. The saturated fat examples are fried foods like French fries or fried chicken, and oils like coconut oil, palm oil, butter, ghee. These all are saturated fat. Better to avoid saturated fat and take unsaturated fat like monounsaturated or polyunsaturated. These examples include taking a low fat milk. So I have talked about risk factors, prevention, and next about the treatment. So treatment part, type 1, it is mainly due to the antibodies to the pancreas causing destruction of the pancreatic cell, and hence no insulin is produced. So only treatment option available for type 1 is insulin that he has to take for lifelong, and reduce food containing glucose. In type 2, treatment begins with the dietary modification. As said earlier, a healthy diet which is containing low glucose level and adequate unsaturated fat, or avoiding refined carbohydrates, and a diet having less salt, and avoiding alcohol and smoking. In also dietary, apart from dietary, in exercise, daily at least 30 minutes of moderate exercise is required. And in medical treatment in type 2, we can give medicines from tablet to insulin. So in conclusion, diabetes is a chronic disease whose incidence is increasing in India and also worldwide due to the unhealthy lifestyle, decreased physical activities. The prevention and treatment of insulin diabetes begins from our home, especially from our kitchen, from taking a healthy diet, having a normal physical activities. Hence, we can prevent and even reverse type 2 diabetes. Thank you.